Hi, good afternoon. I am Dr. Sayan Chakraborty, consultant in infectious diseases at AMRI Hospitals, Kolkata. So I'm back again with another informative video. This time about the new COVID variant and the overall speculation about a new COVID surge that might happen in our country and also in our state and in our city. So just to tell about the variant, like the BF.7, like you must be reading and hearing a lot about it. That's going around in China. That's caused a huge surge in China this time. So this particular variant has been circulating in India for quite some time. The first time it was detected in July, and again in September and October as well. And there is another variant that's been detected is XBB. So this particular variant right now is circulating in Hyderabad, and it has caused a certain surge in number of cases in US as well and other parts of the world like Korea and Japan. So these all variants have been there in India for quite some time, and there has not been a real surge of cases. There we have not seen much of severe cases of COVID with these variants. So there's nothing to panic as such. Government of India and Government of West Bengal as well has come up with certain guidelines to increase the preparedness. So it's always good to be prepared, right, for any kind of increase in number of cases, so that we do have a good supply of oxygen and all the medicines that is required. But don't panic, because we all are ready anyway for these cases. And Indians as a whole, we have got a hybrid immunity because we have got infected with COVID. Most of us, I think almost everyone must have got COVID once or twice maybe. Even if it was not diagnosed, maybe you must have got some fever with like body ache and something like that, cough. And we have taken vaccines. The vaccines that are available in India are really effective, and it may not prevent the infection, but it has prevented a lot of severity. It has prevented hospitalization for us, and we have taken like at least two vaccines, and few people are waiting for the third one. So those who are waiting, definitely please take the third vaccine from your nearest hospital or the government center. And since we have this kind of immunity, so we are not expecting a certain huge surge of cases like we have seen in China. But the thing that has happened in China, why that has happened? Because firstly, the Chinese people, they were under lockdown. So, in the first wave that they had, after that they went for a lockdown, and that lockdown continued for say around 2 years or 2.5 years, and they were actually not infected with the virus, because initially in the first wave that they had, uh, people were infected, but that the percentage of infection was very less. And right now China has opened up, they have stopped the lockdown, and so everyone now who is coming in contact with the patients are getting infected. And also recently there was a report from media that their vaccines are actually not that effective that was proclaimed, because other parts of the world who have used the Chinese vaccines like Brazil, Indonesia, Malaysia and some other countries, they are actually again studying the effectiveness of the vaccine with their population, seeing the antibody reports and all. So these two are the reasons. That's why China has got a certain surge of cases. That is what we are not expecting in India. So don't panic, definitely. And mask, obviously, mask is the most important thing. It's always good to use a mask anyway, because we do have a lot of pollution in India. So that will protect you from that also. And obviously, when you're going to various crowded places, right now we are having the holiday season, we have got so many festivals going on, so definitely you will go out of your home and enjoy. So that's absolutely fine. But yeah, definitely please use the mask, so it will protect you and your family. And we are always ready to for any kind of surge. We have done the mock drills as well, that has been uh, given as per the guidelines by the government, and we have just not just we but other hospitals as well have got all the medicines and everything in stock. But we just hope that that won't be required anyway, because might be some small number of cases, but not something that is going to happen that happened in the second wave that we faced. So yeah, definitely. So just keep your mask up and stay safe. And that's it. That's it from my side. Thank you.